Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health, reporting for the week of April 22nd, 2024. As health professionals rooted in Oakland, serving some of the most vulnerable populations in the Bay Area, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. The goal of the People's Health Briefing is to equip you with the best knowledge and insights to keep you, your loved ones, and your community as safe as possible. This week, after an update on COVID and flu, H5N1, measles, and MPox, I will talk briefly about spillover events and World Immunization Week. First, taking a look at our respiratory virus season, which in the US is roughly October through about now. So first, we can see that wastewater concentrations of SARS-CoV-2 are coming down, certainly not zero, but it is now considered minimal overall and appears to still be heading down. And flu on the upper right there and RSV on the lower left continue to head down as well. We should soon be able to say that flu and RSV season are behind us. Not quite yet, but I think we can safely say that the worst of the season is behind us, and we should have a reprieve until these start back up, usually around October. And on the lower right, we can see that even though we still do have flu hospitalizations in the blue and COVID hospitalizations in the orange, they are heading down as well. So if you are someone that has been putting off any routine health maintenance like preventative health care or dental health care because you're worried about catching something, I know many of you are out there and feeling that way because you've reached out with those questions and concerns, and these are extremely valid concerns, especially if the activity requires you taking your mask off. But all other things being equal, this is a pretty decent time to go and get those things done because cases are lower at this time. And if you're in the Bay Area counties, like where I am, or anywhere that kept masking for the so-called respiratory virus season, the mask requirements may actually still be in effect as well. And I know this is very variable depending on where you are, but healthcare providers should be masking, in my opinion, but at a bare minimum, they should wear one if the patient requests it. So as much as I hate it that anyone should have to ask their provider to wear appropriate PPE, this is where we are. And I hope that you will be able to advocate for yourself as needed, but definitely go ahead and get those things that you might have been putting off. This is a relatively good time to do so, all other things being equal. And taking a look at influenza across the country, we can see that it is quite variable. For whatever reason, we're seeing high circulation in North Dakota and Wyoming. And over the next month or so, we hope to see that most of the country will be in shades of green, but we'll keep an eye on that. A couple of you have asked why I'm not showing the map for SARS-CoV-2, and that is because, and maybe I will show it at a future briefing just to illustrate the point, but essentially there's so little testing going on that really the wastewater is the most reliable thing to look at. When you look at the COVID maps, they're basically all the same color, so not giving us much nuance there. But if and when that changes, because I do look at it frequently, I will bring that back here, but for now, not as helpful. Still, we can get information looking at nationwide hospitalizations and deaths, and we see that thankfully these are both continuing to come down. We have COVID hospitalizations on the left showing that the week ending April 13th, we had just over 6,400 hospitalizations. This is the 14th week in a row that we're seeing declining hospitalizations, so that is certainly reassuring. And taking a look at deaths on the right, the week ending March 23rd, that's the 10th week we're seeing declining deaths. And we know that this number lags behind a bit. It also may increase as more data comes in, so that is a little bit of caveat there. For example, last week when I had reported on the prior week, there were 961 deaths, but re-looking at it today, It's showing 982. So that they can keep adding essentially to the prior weeks as more information comes in. But still, this seems to mark the second week in a row with under 1,000 deaths in the US, which is the first time we've seen this since last August. So August 2023 was the last time we had any week with less than 1,000 deaths. So we're glad to be heading back there and hope we can stay there for a while. But it's still a lot of deaths every week, and we could be preventing quite a bit of this if we would continue to decrease transmission, if we can make sure that those who are vulnerable are staying up to date on their vaccination, and those who are at risk of a poor outcome are getting timely treatment. So these should certainly be our goals: reducing transmission and appropriate access to vaccination and treatment. And as it relates to variants, nothing new to share here yet. We're still seeing primarily the JN.1 variants, nearly 98%. Hopefully it'll stay that way. Of course, we know that SARS-CoV-2 does not stop mutating. The question is whether any of the mutations will have enough difference to get around our prior immunity, and whether these new variants might have enough of an advantage over the current variants to kind of outcompete them. So hopefully things will stay nice and boring for a while. And also hopefully surveillance will stay robust so that we'll at least have some lead time to act in case if anything changes. So in the meantime, let's strive to maintain our best practices for preventing the spread of respiratory infections, but especially to avoid catching and spreading COVID so we can prevent those poor outcomes that are still too many. And that is also including long COVID and post-COVID impacts, which we know are just continuing to mount. Flu and COVID and now RSV are the respiratory viruses that we have vaccines for. So we are at the tail end of the flu and RSV season, but it's definitely worth making sure that you're staying up to date on those vaccines. And remember that an additional COVID vaccine is now recommended for those who are 65 and up, as well as those who are immunocompromised. And for everyone else, the recommendation seems to be to get the updated vaccine kind of around every fall when a new formulation should be coming out that is supposed to be matched to the circulating strain. So much like our flu strategy. So we'll be keeping an eye out for information about that. And of course, try to gather outdoors as much as possible. It's almost always safer than indoors. If you're going to be gathering indoors, wear a high quality filtration mask like an N95 or a KN95. And if you can do anything to improve ventilation and filtration in your indoor spaces, please do that. You can monitor indoor air quality using a CO2 monitor to kind of get a sense of your indoor ventilation, and also to see how your interventions might help, like opening up a window or a door. And let's remember to strategically test and isolate to avoid spreading COVID to others. If you do test positive, please isolate until you turn negative, because enough virus to detect is enough to infect. And we know that we can prevent the spread even within households by taking preventative measures. Remember that catching COVID once and doing fine is not a guarantee about the next time, and every infection is a new opportunity, perhaps even a compounded opportunity for long COVID and post-COVID impacts. And also, please don't push yourself. Allow yourself the time you need to fully recover. And if you're someone who should be treated if you get COVID, you should know that now. Here are the approved treatments for those at higher risk of a bad outcome. And we're still waiting to hear more about PEMGARDA, the prevention injections for those with immunocompromise. We know that it has been approved for emergency use, but it's still not clear where we can find it. So we will keep you posted as we get more information about that. Now, briefly on H5N1. We reviewed it in some detail a couple of weeks ago. Information is just kind of trickling in slowly, which is a little frustrating. Seems to be frustrating a lot of people in the field, people like epidemiologists and virologists, those who want to see pertinent information so they can help us to assess the threat. And I think since the COVID pandemic onset, where we've had the benefit of a lot of information sharing happening in real time, I think that this is now the expectation. I think it is a reasonable one. As a reminder, the reason why there's concern about H5N1 is because it's gone from being primarily found in birds to now having spread to mammals, and now having spread to cows, which are obviously animals that here in the United States we tend to be in closer contact with through our industries. And now we have even seen spread from mammal to mammal, so from cow to cow, and even the recent case in Texas, which was cow to human. So this is all a little bit new, and we don't like this kind of new. I'm going to talk about this in a little bit, but there's a lot of questions that this brings up that we want answers to. So first off, are there significant mutations that are making this more possible? So far, we're being told not so much, but we're also not really seeing all of the genetic sequences being uploaded as we've become accustomed to seeing, like with SARS-CoV-2, where people are uploading these sequences from all over. And because I think these are cows, and so perhaps we have new regulatory agencies involved, like USDA, and these sequences just are not being uploaded in a way that I think folks want to be able to see them. So we want to know about the genetic sequencing. We also want to know how it's spreading between cows. So what is the mode of transmission? We're being told that it doesn't seem to be respiratory. Maybe it's contamination of equipment. We're not really being given a lot of details about this. And so we kind of just don't really have those definitive answers yet. Also, we're being told that pasteurization of milk will kill any H5N1 that might be present, which is great. But we're not really being told if these tests are routinely being done on the dairy products, and if so, how often, or how they're deciding which samples to take. And these are things we really want to know. We're also told that there's a vaccine that could be available right away to vaccinate some portion of the population, but we haven't really seen the studies we might expect to kind of help to demonstrate that, at least, not publicly. And we haven't seen any kind of plan about what a rollout might look like or what might prompt us to start vaccinating people, especially those that might be at higher risk, which right now appears to be anyone that works closely with cows, or actually a number of different animals that have now shown up with this infection. So I think at this point, it is fair to say that we don't think there's any need to panic, but at the same time, we do want to know how big of a concern this really is for the average person. So we're going to continue to be on alert for that information. In the meantime, please avoid consuming any unpasteurized dairy products and uncooked or undercooked meat. And we definitely don't want to be handling any sick or dead animals. And now moving on to measles. So we've got already in 2024, 125 cases of measles. 54% of those folks have had to be hospitalized. And you kind of see that this seems to just kind of be increasing month over month. And we've already surpassed we're just in April. We've already surpassed all of what we had in 2023 and all of what we had in 2022. So certainly not liking that trend. And I went over in a little more detail last week about how this does seem to very much be tied to pockets of low vaccination rates among children. So this is very concerning. We know that it can really spread like wildfire through an unprotected population. This is what we would like to avoid. So for the most part, if you're fully vaccinated, you should not have too much to worry about. Although 5% of the cases we've seen so far this year were in people who were fully vaccinated. Not really sure why some people might not mount a good response. Normally, we have not had to test this out because we've had population immunity, but we're a little bit at risk of losing that because we're dipping below that threshold that we would like to stay at for measles coverage, which is 95% of people being fully vaccinated. So please make sure you're fully vaccinated. 13% of the measles cases so far this year have been in people who had 1 dose. So need the 2 doses to be well protected. And please make sure the children in your life are fully vaccinated. And also, because we know that, first of all, we cannot protect the babies really under 1. They're not eligible for the vaccine until they're 1 year old. So we want to make sure everyone around them is vaccinated so that we can protect them. We know that for those who are not vaccinated, if they go anywhere near someone who's contagious, there is about a 90% chance of getting sick with measles, which we know can be life-threatening and even lead to death. And if you will be traveling internationally, no matter where you're going, please make sure you're vaccinated. If you're traveling with an infant that's between 6 months and 1 year of age, the recommendation will probably be to get them started early on that MMR series. We can go as young as 6 months just to protect them on the trip, because there are outbreaks happening in a lot of parts of the world right now. So please check with your child's pediatrician on that. And now for an update on MPox. Didn't think I'd be doing an update on MPox so soon, because last week Dr. Kenji Taylor did a great overview of MPox. If you're interested in that, the link is in the post. He talked all about the rash and other signs and symptoms, who's at risk. He talked about vaccination and treatment. And then just shortly after that, a preprint came out that gave a lot more specifics about an MPox outbreak that has been going on since 2023 in the Democratic Republic of the Congo, or the DRC. And this is significant because it's from a different strain, a clade. Actually, it's called clade 1. And the strain that had caused the global outbreak in 2022 that we saw here in the United States was actually clade 2. And as we heard in last week's briefing, clade 2 is not nearly as deadly as clade 1, although it can be very serious, especially in those who are immunocompromised. The thing about clade 1 in the Democratic Republic of Congo that does have us concerned is that it seems to be spreading through sexual spread, and then from there spreading to household contacts, including children. So we'll definitely wait for this article to be peer reviewed, and we'll wait for more data to come out. But I thought this was significant because in this situation in the DRC, 30% of the lab confirmed cases were among sex workers in the DRC. And this is person to person spread. It's been happening, it looks like, since September of 2023, so the last 8 months or so. And this is happening at the same time where we're kind of gearing up. We're getting alerts here in the United States about our need to do a better job to prevent the spread of clade 2, to make sure that those who are at risk get vaccinated and do what they can to prevent the spread. So this is just something we'll be keeping an eye on. So far, there are no clade 1 cases outside of the DRC, but the authors of this recent preprint are certainly urging that the world pay attention, because the way that clade 1 is spreading is new and of concern, and because this has pandemic potential. So I just wanted to point out here that, similar to what we're seeing with avian flu or H5N1, we are getting this, what is called spillover. So I'll take a moment to define this. A virus spillover event is when a virus basically moves from one species to another. So just like what we believe happened with SARS-CoV-2, where it spilled over from bats to humans, there might have been an intermediate host there, but essentially it spilled over from an animal reservoir and basically made its way to human beings. And this basically requires that the virus change in such a way that helps it to overcome whatever barriers were preventing it from taking hold in that species in the first place. And usually this spillover event means that the new species is in close contact with the species where the virus is already hangs out or is in basically like a reservoir for that virus. So it could be years or decades in a reservoir in birds, for example, then spill over to mammals by being in close contact with them. This is what we're seeing with avian flu, and we're worried about spillover to humans. The other thing, though, that has to happen in order for spillover to be successful is that once the virus goes from one host species to the new host species, then it has to be able to successfully transmit within members of that new species. So we've not yet seen that with H5N1. We have not seen human-to-human transmission of H5N1, but we have seen it now with MPox. So these are just things that we have to be alert for. What can we do about it? Well, for the average individual, it's going to depend a lot on where you live and what your risk factors are and what pathogens you need to be concerned about. For example, with H5N1, we should not be touching dead birds. There's a chance they might be infected. We can spread it in that way. But I think probably most importantly, we cannot forget about the power of vaccination. And this happens to be World Immunization Week. And despite all of the misinformation, disinformation, and the unfortunate sort of downright anti-vaccination efforts, it is really important that we remember that vaccines are one of humankind's most significant achievements. Vaccines have had a profound impact on our quality and quantity of life. Vaccines have made it so that many more children survive to adulthood. We've eradicated smallpox with vaccines. We've gotten pretty close to getting rid of polio. We still have a lot of work to do here, especially to overcome some of the backsliding that has happened over the past few years. So as usual here on the People's Health Briefing, we want to make sure we're cutting through all of that noise and all the chaos and staying focused on the things that will help us to survive. And getting the appropriate vaccinations is definitely one of those things. And an important part of accessing the vaccines, of knowing which ones you need to get, is having a primary care provider for your children, having a pediatrician. Please, if you do not have a primary care provider, please get one. Don't wait until you think you need one to try to find one. Know how to reach them before you need them. They will certainly be able to make sure that your children get all of the vaccines that they need. If you have concerns about them, talk it through. That is what informed consent is all about. It means that you understand what are the risks, what are the benefits, and when it comes to all of the routine childhood vaccines, hands down, you will find that the benefits far outweigh any of the slim risks that may occur. Everything has risks to it, so no one's ever going to tell you that there's zero risk to anything. Get the information that you need, satisfy yourself, but at the end of the day, please protect yourself. We want to see our children grow up into adulthood. And also, adult vaccines, some of them are important for especially some of our older age groups and in particular situations. And so this is something that you will want to definitely review with your primary care provider. And in addition to all of that, you're going to want to make sure that you are checking blood pressure and baseline labs like sugar and cholesterol. Please establish a relationship with your primary care provider. We all deserve to have that person who knows us, knows about our health, and is in our corner, and that we can call if there's an emergency or anything else going on, that we're not scrambling to find someone when we need them most. And as always, please remember to eat a balanced diet, incorporate fresh foods, avoid sugary drinks, avoid those packaged and processed foods, get some regular physical activity, some fresh air. Unless, of course, you don't feel well. In that case, please get your rest. You still get the fresh air, but make sure you get your rest, manage those stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us. We'll see you again next Tuesday at 10 a.m.